What does a person have to have personally to be able to become a teletherapist? Do you have to have a background? Do you need that training? Do you need specific training? What would you say to a speech pathologist out there who might be listening to the podcast who is like, maybe that's something I might be interested in?
Mm-hmm.
Do you recommend having any specific training?
So, for me, what I have seen is the most important training is just experience in your job as a speech language pathologist. I really encourage, and we at AMN, we do require at least 1 year of on-site experience as a school-based SLP before being eligible for a teletherapy position. That's very intentional. And, ideally it would be even a few years, because we know as school-based therapists that we have such a broad scope of, our role encompasses so many different areas of working with all kinds of kids, all kinds of disabilities, all kinds of, levels of, whether it's very mild to moderate to severe, it's just a very broad scope, and it takes time to get experience,
Yes.
But I think that the most important thing, is having physically been part of a school, understand how schools work, how IEP teams work, that you are part of a team, because it can be really challenging to be a remote in any position and not really have that perspective of who you're working with. Like, what am I stepping into? What am I joining? So, I think that's the most important thing, is at least a year, if not more, of having kind of done the full scope of, evaluations, developing IEPs, running IEP meetings, completing or being a case manager for, some of those speech only kiddos. That, at least, as SLPs, you have that perspective, you have that reference point, so that when you do join a team as a remote SLP, that, you have that picture and kind of what you're joining, what you're stepping into. And then as far as teletherapy training, I think that there are absolutely tips and tricks, things that just, over time, those of us who have been doing it for a long time, little things that you just pick up. Like, if I'm running an IEP meeting, I make sure that I have the list of everybody who has been in, the names of everybody enrolled, everyone who's been invited to that IEP meeting. So in case the audio is not great and they set it up so that everybody's around a big table and I can't hear necessarily, I am not relying on that to see who's there in the meeting. It's easier to have the name. I'm like, oh, okay, this person, check. This person's here. This person's here. So, which those are just things you pick up with experience. That's not about being an SLP. That's just about, really working remotely, like some of those things that help. But, like I said, teletherapy is not a different form of therapy. It is, if you have the skills to work with those kids in person, then you figure out how to transition that into a remote setting. If anything, I really think it sharpens our skills. I feel like I say that it's an extra tool in our toolkit. SLPs, we build that toolkit, and that's what we do throughout our careers, is just add more tools. It's just another one. And I think that I became a better therapist when I moved to teletherapy, because I did have to
agree.
Yeah, I did have to think differently about how I approached working with certain students or certain goal areas. But I think you realize that, maybe what I thought was required was not actually required. That was just sort of a crutch I was using, because they're in person, and now I just have to get a little creative. And, it has, like you said, the kids are so responsive.